to have this sort of screening and be more aware and be more sensitive to this devastating disease. So this morning, I want to talk to us about the role of neurosurgery in breast cancer. Breast cancer and how neurosurgeons play a particular role or special support in the management of breast cancer. It's exactly 8 o'clock this morning, and I will take the time to talk about this topic. Uh, I believe that some of you have joined us on Instagram, some of you have joined us on YouTube, Facebook, and then also on your various radio stations. So I want to thank everyone for taking the time out of your comfort zone to be here. Traditionally, we had this discussion where I was in the studio so we could discuss it um, as sort of face to face. But because of my current location, we want to do this via online. So your feedbacks and also your comments will be very much appreciated at the end. Mepɛ sɛ meda mo nyinaa ase sɛ monya time mmerɛ adwane yɛ again on Hot Digital Online, the most popular radio station for the Ghanaian community with more than 2 decades of experience. Now, this month of October has been the month of breast cancer. I know that for the few times we've talked about prostate cancer, which is mostly for the male population. And then, per se, you can't breast cancer awareness issues. Into the main specific topic is about the role of neurosurgery. For the benefit of our audience, I would try to explain a few things to help people understand what I want to talk about. And neurosurgery is mostly the medicine of the brain and also the spine. Now, one would ask, what is breast cancer? What is breast cancer and why am I talking about breast cancer today? Again, I would emphasize that the month of October, today I believe is the 1st of November, but the most immediate month that has just passed has been about breast cancer. And there's been many movements, many outreaches, many exercises to sensitize people about breast cancer. And I want to take the opportunity to talk about the role I play, the role any neurosurgeon play in the management of breast cancer. Now, there are many types of cancer. So a lot of the parts of your body can have what you call cancer. Now, cancer is a malignant disease, which means that it's a disease that can do terrible things to us, can affect us in many ways. You can have cancer of your skin, you can have cancer of your throat, you can have cancer um, of your brain, you can have cancer of your spine, you can have cancer of bone, and if you're a child, we can have cancer in the adult population, we can have cancer in the children population. Essentially, different parts of your body can have cancer. Now, if the cancer develops in the specific part of the body, we can say it's primary cancer, which means that it's coming from where you found it. So if it's a cancer of the skin, we say that's a primary skin cancer. Now, if the disease has developed from somewhere else and it has spread to different parts of the body, then we call that secondary cancer. And the way that cancer spread is through different ways. Sometimes it's as a result of direct spread, where the cancer just move and grow and get to invade different parts of your body. Now, by definition, cancer means anything that is growing in abnormal manner. Anything that is growing in abnormal manner. So um, if you say cancer of the breast, it means that it's just something is growing in your breast that is not supposed to be there. That is not supposed to be there, and that can be what abnormal in its own right. And if it's abnormal growth, we say you have cancer of your breast. Okay, so that is a bit of a lay down or background information. So we want to know how the neurosurgeon, one would think that, okay, we are talking about the breast, we are talking about women. These are mostly women medicine, which is either by the gynecologist or for that matter, other female related experts. But we, the neurosurgeons, play a very, very important role in the management of many cancers, but today I want to just focus on breast cancer. Again, a very good morning to our audiences in your homes, to our lovely friends who have joined us on Instagram, those on YouTube, those on Facebook. We are in the early hours of 8 a.m. Saturday morning, the 1st of November. We want to discuss about some health issues. Now, if you would have some questions, you can either send them on Instagram. Unfortunately, this time we cannot have call-ins, but I believe that my brother Van Dyke might find a way that people can either send their questions to us, whether he can send them to me by WhatsApp, and I'll be able to answer them as I go along. Um, Otherwise, we would find a different way. Okay. So now that is the background information you have. You are listening to your brother Mark, who have engaged with you in the past, and I'm back again to discuss health issues. Okay, now it is important to note that the most common cancer among women worldwide is breast cancer. Yeah, the most common cancer among women in the world is breast cancer. Okay, so it's an important, disease that we have to pay special attention to it. Yeah, so it's important that we increase the awareness of this disease. Yeah, so you will take it for granted that breast is mostly covered, etc., etc. Maybe it cannot kill you. Disease that affect your breast might not necessarily kill you, other, but that's not the case. Yeah, cancer is considered to be devastating. Cancer is considered to be deadly disease. So you don't want to have anything of that sort. Yeah? So 1 in 8 women may be diagnosed in their lifetime. Yeah. So I repeat that again. If you take every 8 women, one of them might be diagnosed with a breast cancer. That is scary. That's a scary number. Obviously, there are different types of diseases that can affect your breast. But today we want to look at just the cancerous part of breast. Yeah. In Ghana and globally, breast cancer remains a significant health issue. Yeah? It's a significant health issue, and advances in screening have improved survival. It's important to know that because in this modern age and time, we have improved screening. By screening, what this means is that people are getting checked regularly, whether it's monthly, whether it's yearly or quarterly, as often as possible, and to ensure that they are not developing this disease. And if it's developed, then it means that it can be what they are detected early. Yeah, screening and awareness has increased in breast cancer. So as you probably aware, and the same goes with most diseases that by and large we are getting more awareness, more sensitization, and this is helping in what? In the management of diseases. So one, again, breast cancer is the most common cancer among women worldwide. Like I mentioned before, we have different kinds of cancers. You can have cancer of your skin, we can have cancer of your kidney, we can have cancer of your stomach, and your some of your intestines could have cancer. But of all the different types of cancers that you have, breast cancer is the most common among women worldwide. Okay, as I mentioned before, we are looking at the role of neurosurgery, which is neurosurgery means what? Is a medicine of the brain and a medicine of your spine. Yeah. So how does breast cancer affect the nervous system? Is the next thing I would talk about. How does breast cancer affect your brain or your spine? Is the next thing I will talk about. Again, I want to take the time and the minutes to thank everybody who has joined us on Instagram, who has joined us on YouTube, Facebook, our different social and social outlets. Tell a friend, encourage a friend to join us. 8 a.m. to 9 a.m. I will be in your homes. I will be in your on your phones, talking and deliberating on some of these topics. Occasionally, there will be different colleagues of mine who would also come and discuss other things. But every time I'm here, be assured I would I would I would I would talk on things that are pertinent, that are important to help us understand some of the health issues we have. Okay, so it's about a quarter past 8. Again, thank you for joining us. Very big good morning to you for being part of us. So, breast cancer can affect your brain or your spinal cord. Yeah. And we call, there's a fancy name for this process, what we call metastasis. It means that spread, it means the disease is spreading. Now, think about it. Look at the position of your breast, is which is on your chest. Yeah. But if a disease is in that breast cancer, it can go to your brain, it can go to your spine. And the way it does that is by traveling through your blood vessels to get to your spine or to get to your brain. Okay? Now, because when it gets to your brain, we now call it a secondary disease because the disease has not originally developed from your brain, but it has developed from your breast and it has traveled at a distance to your brain. So we now call it secondary brain tumor, secondary brain tumor, or metastatic brain tumor. Okay, now because the brain is such an important aspect of our body, yeah, the brain has different roles it plays. Now, the disease from your breast can spread to different parts of your brain. Yeah? I will not bore you with the details and the intricates and the dynamics of uh, the brain because we cannot cover that within 1 hour. But the common things that I would mention, just to say, because the brain controls our movement, the brain controls our vision, the brain controls basically everything that you are able to do. If you take your brain and your heart, we consider them as what the motherboards of our body. You can't do anything without a brain, yeah? And because the disease can go to any part of your brain, it means that the disease can present in different manners and ways depending on where it's located in your brain. Yeah. So your breast cancer can spread to your brain. Yeah. And if it does that, sometimes the first thing that you can get is what we call headaches. And the reason you get headaches is because there is a pressure effect that would develop once you have a secondary tumor in your brain because the brain in itself has a fixed volume. So if anything extra goes in there, it translates as pressure. If you have a small box and you fill it with anything, for example, even gari or sugar, for example, and you continue to add it, you continue to add, you continue to add, eventually that thing would what? Would could explode because of what? The pressure effect. So in the same way, because the brain has a fixed volume, if anything extra goes in there, it translates as pressure, and that pressure effect becomes headaches. Sometimes you feel heaviness in your head. Yeah. And then also sometimes you can have visual issues, so vision, changes, because like I mentioned before, especially at the back of your head is where your vision center is. Obviously, there are certain fibers or tracts that travel in the brain, and sometimes the middle part of your brain, the front part of your brain. If the tumor gets to some of these parts, then it can affect your vision. As I mentioned also, because the brain controls our limbs, movement, muscle, and everything, there are certain specific centers in the brain that if the tumor gets to those areas, it can cause weakness. It can cause what you call weakness. Yeah. And also, there are activities in the brain that can be triggered by this brain tumor, and it can translate into what you call seizures. It can translate into what you call seizures. So sometimes you can have a seizure that can be catastrophic. It can cause you to collapse. It can cause you to fall down out of nowhere. Yeah, I believe you're with me. I will take a minute again to acknowledge our listeners for taking their time to join us in their rooms, in their homes. Maybe you're at work or maybe you're on your way to work. We want to say thank you again. You are live on Hot Digital radio station. Today I come to you as your friend, your brother, your son. I go by the name Mark, but you can call me Dr. Mark. That's still fine. And today we are talking about the role of neurosurgery in breast cancer. So, Breast Cancer Awareness Month, the month of October. I'm sure you've had some sort of information or discussion, whether in your churches, whether in your workplaces. Um, we are continuing in that vein. Okay, so we have also said it can go to your spinal cord. Yeah, so that is in brief about what? About the brain. If it gets in different parts of the brain, it can cause things like headaches, can cause things like seizures, can give you vision problems, limb weakness, or sometimes it doesn't cause any of these symptoms. It could be completely asymptomatic because sometimes the tumor is just small, it's tiny, it's not big. Yeah. So in that case, sometimes it doesn't necessarily cause you problem. You would not know it, and that is why screening is very, very important. Yeah. So if you do your screening, then things can be detected early, and then we can nip things in the bud. Nti me maame no me nua no mo meda mo nyinaa ase sɛ mo amonim sɛ metwee ne nhyɛ da nkɔ yie saa, but I try my best to sometimes chip it in here and there. So forgive me if I am wobbling too much on the English language. Okay, so the breast cancer can go to your brain, it can also go to your spine. Now, bear in mind, your spine is a bundle of nerves, and your brain and your spine are in continuity. So, the things that your brain wants your body to do, a lot of the time, it does that through communicating with your spine. So, the spine as a whole comprises of some bony structures and also some soft tissues. Now, the cancer can go into the bone. If it does that, sometimes you can get what you call back pain. Yeah. So, because your bone is infiltrated, so every time you walk or you mobilize, there's pressure on the spine. And sometimes the disease can be so infiltrating that it can cause what you call instability. Instability. Yeah. And that instability can translate into pain, and that instability can cause things to move in places that they shouldn't move. And if it does that, sometimes affects your nerves. Sometimes you can have uh, bladder problems. You're struggling to pass urine properly. Sometimes it translates as pain in your leg. What you call sciatica can also develop. And if the tumor has gone to the soft tissues themselves, or if it's putting pressure on your spinal cord, then it can completely paralyze you. You can lose your limbs, it can cause numbness, you can lose your hands, it can do things that we don't want. Yeah. So the breast cancer by default can do all of these things. So it can present in these sort of what symptoms. So it's not just your breast that you can have the effect from, but if it goes to this part of your body, it can give you these problems. Okay, now one would ask, what is the rate at which this spread of disease to the brain or spinal cord happens? What are the percentages? What are the numbers? Yeah? And it's stipulated that it occurs in about 10 to 30% of advanced breast cancer cases. So if you have 3 people with advanced breast cancer disease, at least one of them will have tumor or secondary brain tumor or secondary spinal tumor. So the numbers are worrying, the numbers are worrisome, and it's important that we take advantage of the screenings that are available. So the numbers tells you that this is not something to play with. And if it gets to your brain, sometimes there are so many, so numerous, that sometimes it becomes a bit too late. And I have seen firsthand people who have breast cancer and they've come to me at a later stage, which makes it very, very difficult. Obviously, there's strong effect on the person, a strong effect on the family, their children, and everything. So if we can avoid it, then we try to avoid it. Okay. Um, and because it goes to your brain and spinal cord, that is why specialist care in the form of neurosurgery is important in the management of breast cancer. Okay, wonderful. Again, abusuafo, medamu nyinaa ase. Every now and then I have to take some breaks to thank and appreciate you for taking the time to join me and being part of this discussion. For those of you who are listening online, if you can type in some questions, either on Instagram, either on Facebook, or even in YouTube on the comment sections, if you have subscribed to Hot Digital, I'm sure we'll find a way to be able to answer them. I think there's a WhatsApp line also, which I mean, with time, you might be able to even send a message on WhatsApp and we can have a look at it. And then we can try and answer them as I continue with the discussion. Fortunately, the call in section on this occasion is not possible, but we are scratching our heads. We are finding a ways. We are looking for ideas and ways to chip that in, at least whilst we are doing this online. Okay. Now, on to the next stage. Okay. How do we actually diagnose these metastatic lesions? So, like I've mentioned before, maybe you're having some headache, maybe you've had a seizure, for example. Okay. And for those of us who don't know what a seizure is just sometimes you become unconscious, sometimes you find abnormal movement in part of your body. It could be your leg just moving and shaking and jerking out of nowhere. Maybe it's just your face which is jerking, or maybe sometimes you have some sensory disturbance on your face or some sensory hallucinations or auditory hallucinations. There are different ways that a seizure can present itself. Yeah. So when you have some of these things, or maybe you have significant back pain that's lingered on for a couple of weeks, it's not going away with medication, it's not going away with any form of exercise, or you're struggling to now maybe walk properly, you have some numbness in your legs, numbness in your hands, the sensation doesn't feel quite right, then you present to your doctor, you present to your neurosurgeon, you present to a family medicine, a family doctor, and they will do what we call brain imaging. Okay. Now, brain imaging comes in the form of either what we call the plain scan, which is a CT scan, with a couple of X-rays, really, just advanced form of X-ray to look at the brain or to look at your spine. And occasionally that will show something, but there is a more advanced form of imaging called the MRI. And it's important that I say these things because I have noticed some of my aunties and some of my mothers in Ghana, they don't like to do MRI. They say, oh, it's so dangerous. It's it makes all this noise and it's not very, very, attractive. But it's something that can be very, very useful for the diagnosis of what? Of the disease. Okay. So that is by and large, mostly those are the first stages. Blood test is useful, but it's not very, very it's not adequate in that we can do some blood markers, to check, breast cancer diagnosis. But when it comes to just finding the tumor itself in the brain, then you need your scan, or finding it in your spine, then you need some form of radiological imaging. Okay, that is the first simple, is non-invasive. It doesn't involve any cutting. It doesn't involve any form of surgery. Just the imaging is normally just enough to detect it. Okay, yeah. So detecting it and finding it by taking some pictures is the first stage. Then you ask yourself the next question. Now, once you have found it, what do you do? What's the next thing? Okay. When that is found, that's when normally you'll be referred, or you'll be sent to either an oncologist or a brain doctor, or a spinal doctor for that matter. Okay, a spinal surgeon for further um, input, what you call expert opinion. All right. Now, when you go to the neurosurgeon, because a lot of diseases can also look similar to what breast cancer looks like, especially in the brain, they would want something more to do to be able to what? Confirm this diagnosis. Okay? To be able to do to confirm this diagnosis. Okay. Now, the diagnosis by itself is probably the most important aspect of the whole spectrum of the management of a breast cancer that has gone to your brain. Okay. So if the disease has gone to your brain, the first and most things that you perceive confirm is that, okay, nipa will what breast cancer. Is it certain that whatever we have found in the brain or your spine is also breast cancer? Okay. And the only way to know that is taking a piece of that tumor and taking it to the laboratory and then doing some smart things to it to confirm the diagnosis. So that in itself will come with some form of what? Surgery. Okay? Now, the details of the surgery again, too much details, otherwise some of you might not be very happy or you might not understand. So I'll do a bit of touch and go here and there. In that, the first thing you can do is what you call a biopsy. Biopsy means not removing the whole tumor, but taking a small bit. And sometimes we do that through a small needle, going very tiny under what you call brain navigation or brain GPS, as you call it, to take a small sample and then taking it to the lab to do some tests on it. Or often and large, we go in there. If the tumor itself is very big, then we go into the brain and then we take the whole tumor in its entirety. Take the whole thing out and then take a piece of it to the lab. The reason for this is because, as I mentioned before, sometimes the disease causes headache, it causes weakness, it causes seizures, it causes loss of consciousness, it causes incoordination, it causes visual problems, it causes um, confusion. Yeah. So when some of those symptoms are presented, then taking the disease away can help to alleviate some of these symptoms. Again, a very good morning. We have come about 30 minutes on the clock. It's 8:30 at the moment. We are talking about breast cancer, the role of neurosurgery in the management of breast cancer. If you are listening to us from your rooms, if you are listening to us from your work, if you are listening to us in any part of the world, you are on live hot digital radio station. This is a time with your friend, with your brother, Dr. Mark, or popularly known as Mark for short. Um, Thank you so much for being with us, and then thank you for joining us on our social media outlets, Instagram, Facebook, YouTube, etc., etc. Yeah. So we are looking at the treatment options. We've said first and most important is we need to confirm the diagnosis, and that can be done by surgery only. It can come in the form of small surgery or bigger surgery. Yeah. So what the small surgery does is that it only gives you a diagnosis. What the bigger surgery obviously does is that it gives you a diagnosis and also sometimes relieve you of the pressure. Okay? Or relieve you of your symptoms. Yeah. If it's in your spine, obviously the treatment will be slightly different depending on, again, where the cancer is and what problems it's causing. It can come in the form of getting the interventional radiologist to, again, use their x rays or their CT scans to pass a small needle into wherever this tumor is located and getting a small sample and taking it to the lab to confirm the diagnosis. If that is confirmed, then we can think about the next stage of what? Of the treatment. If that is not deemed appropriate, then sometimes you go in by what? Doing a bigger surgery, which involves making a cut and making your way down to where the tumor is and then sort of fishing it out. Sometimes it requires you having some screws in your back to stabilize the spine after the surgery is done. Sometimes we don't need the screws, just sometimes just taking a few bits of bone out and then taking the tumor out will be just enough. Okay. Now that's a bit of what details, a bit of what intricates, and a bit of what juice I've given you. Yeah. If you have more questions on that, kindly put your questions on Instagram, put your questions on the Facebook, put your questions on YouTube comment sections, or even on the message WhatsApp uh, um, numbers. You can drop in a quick question there, and then we'll be able to read it. Either I will find a way to answer them one way or the other. Unfortunately, today we can have a call-in sections. I really, really apologize for that. For your all your understanding. Um, then the next thing is what? Is what we call the recovery. So some you to once we've gotten the diagnosis, most of the time you can go home a day or two after this sort of procedure. Obviously, the lab work takes some time, so after a couple of what weeks, most of the time 2 weeks is just enough. We would have the diagnosis. If it's confirmed, then we'll bring you back or we'll give you a call to discuss what happens next. Okay. By and large, I have touched briefly on the surgical techniques that we use in the cancer treatment, where we've said that what? Just a biopsy, which is a small surgery, taking a small sample to the lab, or a bigger surgery trying to remove the tumor in its entirety. And that is surgery. Yeah? There are other non-invasive targets, what we call radiosurgery, which is using radiotherapy or some form of beam to sort of zap the tumor and then kill it. Obviously, this also comes with its own effects and its own side effects. Sometimes it's whole brain radiotherapy, sometimes it's what? Single brain therapy. So it's just specific part of the brain where the tumor is. You get the x-rays of the radiations fired directly to that. You zip it, you zap it and then you do some serial images to confirm that the tumor is being taken out of the way. The choice between this or that comes down to one, location of the tumor, two, size of the tumor, and three, sometimes the physical state of the patient we are dealing with. Okay, and all these things sometimes help in extending the lifespan of the patient. Yeah, like we mentioned before, cancer is what? It's a devastating disease, it's a dangerous disease, and we don't want anybody to get to come to have the cancer. So as we are in the period of breast cancer awareness and everything, it's important that you get checked, you do your screening, all the available screening services that are there. It's important that you explore them. It's important that you you take advantage and get checked. Occasionally, cancer in the brain can cause what you call hydrocephalus, which is the buildup of fluid in your brain. And if that happens, sometimes we do what you call a shunt procedure, which is inserting some tubes in your brain to drain some of that fluid, sometimes in your tummy, and you have that permanently to help prevent you from dying. It's mostly a life-saving procedure, or it's what you call a palliative procedure. It sort of extends your life span or your life cycle and allows you to spend some quality of time with your family. Sometimes you are able to even go back to work. But again, I must say that um, breast cancer, if treated appropriately at the right time, the outcome is very, very good. Okay, again, a big good morning to everyone. Me mama no mo, me papa no mo, me da mo nyinaa ase sɛ monya time join today on Hot Digital. If you have any questions at the moment, please either you write them down, or question be our person bisa efa breast cancer or efa the role of neurosurgery in breast cancer. Mpacho for message you know Eden eto either WhatsApp so and answer with time no mbetumi ayɛ den discuss it my brother Van Dyke when I find a ways to deal with that. So if you have any young female friend, wife, sister, mother that these topics are important for them, um, you should let them know what we are discussing, and then we can find a way to reach them. Okay. Now, cancer in itself is a multidisciplinary team approach. So the management of all cancer patients needs a team. It's not a one-man show. You need a full set of team. Now with breast cancer or any brain cancer, the team that normally should be involved, and this is by no means should be taken for granted, because you need to have a holistic treatment for the patient to get the best form of what treatment. Okay. Now, for the purpose of what we are discussing, the first people that needs to be involved in this care are neurosurgeons, people like myself, an oncologist, people who deal with cancer in general, and a radiotherapist, um, um, who is who are the ones who do the radiosurgery. As I mentioned before, you can use radiations to kill the tumor. Okay, and then palliative care specialists. Palliative care are people who deal with people who have diseases that we consider sometimes can be deadly or can be terminal. So palliative, they give you proper support. They walk you through the disease in every stage of the disease. They give you the support that you need. Then you need a psychologist. Psychologists are very, very, very important. Yeah, psychologists are very, very important in cancer management. Okay, so I'll repeat again: neurosurgeons, oncologists, radiotherapists, palliative care specialists, psychologists, and also the family support is very, very important. So sometimes when you come to the hospital for some of these chat and discussion, it's important to come with what? With your partners, with your family members, because by and large, they have to look after you. They have to take care of you throughout the journey. Okay? So when you have them around, they would have lots of questions that they can also answer. And especially sometimes when you are diagnosed with some of these diseases, it comes as a shock. So you might not be in the right state of mind. Until your family members will be able to what? Support you. Again, I want to say that we might have a window. Say, question now, bisa. I will say that my number, you can call me directly. Um, for now, and then we can answer some questions. Um, the number for today will be 0744, and this is for only today. And then number umetimi frame me so 0744743211. Nti ene upe uwo question bi na upe se ubisa me the number we to dwa se ubetimi afre so 0744743211. Maybe it's only about 15 minutes to 9 o'clock. Inti maybe kasaka kra na must stop it. I will leave the last 10 minutes out to wait. That uwo question bi na opese ubisa ubetimi abisa. For this today, the number ubetimi our friend is 0744743211. Okay. So abusianfo medamuna ase semonya time emre ajoin here hot digital today to discuss about the role of neurosurgery in breast cancer treatment. Okay, so we've had a good understanding. The disease is from your breast, it can go to your brain, it can go to your spine, it can cause many problems like headaches, vision problems, loss of consciousness, seizures, weakness, etc., etc. In the mamo, one case example, this is a typical example of a patient that came in and how they presented. So this was a 45-year-old Ghanaian woman who had breast cancer and developed headaches. Yeah. So she went on to have a brain MRI, which showed some tumors. Luckily for her, there was only one tumor. So what happened was she went on, she had a neurosurgery treatment. After a couple of weeks, she had further radiotherapy, and 1 year follow-up showed she had good recovery. She had good recovery, and this improved her quality of life immensely. So the disease, if identified early or caught early, can be what? Zapped, can be sorted, and can be what? Finished. Okay? Now, obviously, the disease, breast cancer management has challenges, especially in Ghana and Africa. The number of neurosurgeons in the country is limited, so that alone is challenging. Access to MRI and advanced treatment centers is also not readily available, so that is again also challenging. And because of stigmatization and limited awareness, patients normally present very, very late. And when they come late, sometimes you do a scan of the brain and you find that there are more than 20 brain tumor in the brain. In those instances, sometimes it's very, very difficult to what? Salvage the situation or to solve the problem. You might do something, but the quality of life after that is not very, very um, encouraging. So, what's the way going forward? The way going forward is that we want to encourage breast self exams. You can examine your breast, you can be taught how to examine your breast regularly. If you are developing any lumps and bumps in the breast, then what? You can easily reach out to your doctor to have it confirmed, to have it appropriately checked. Hospital visits should be regular, especially women of a certain age group from 30 years old and above. You should have regular examination checks. Support training, cancer specialists to support training of other medics to let them understand the disease properly. And then we need to advocate for better healthcare funding and technology. I mean, in Ghana, I think we are moving in the right direction, but we need to do a bit more. Centers like UGMC are very good. Kolebu, obviously, it's creme de la creme. It's a cradle of what? Health. And Rate Center is also appropriate there. And other private centers will be very, very useful. Okay. So I want to conclude here. We have just about 10 minutes to 9 o'clock. I'm going to end here for a minute. And I'll conclude by saying that neurosurgery plays a vital role in managing brain and spinal secondary diseases, especially breast cancer. Early detection plus multidisciplinary team approach results in better outcomes. Let's promote the awareness and let's encourage access in Ghana so that anybody who happens to be found with this disease can have the care that they need. I will say the numbers again for the benefit of those who have not joined, that we have 10 minutes. You can call 0744743211, and then I would answer and I will be able to answer some questions or any other questions you have now. I will take a minute and I'll take a break for now. Medamoina also. Sɛ wotumi nso ɛmfrɛ a wobɛtumi ɛde wo message no ato ato Facebook anaasɛ Instagram. Yes. Na sɛ wowɔ message bi a wobɛtumi afrɛ and then we can discuss it further. Abusuafo, bɛsɛ meda mo nyinaa mase. I want to thank you all for the time that you have expressed interest in speaking to us today and then also joining us online. Like I've mentioned, the last 7 minutes, you can give us a call on 0744 7432 to ask any question that you have regards breast cancer. Whilst I'm waiting for someone to give us a call, I would touch briefly again and remind those who might have joined late that my name is Mark. We've been talking about the role of neurosurgery in breast cancer for the meantime. This is the first time we are trying this via remotely or virtual, and we anticipate there might be some difficulties with some of us, especially because in the past you see my face, you see me live in the studio, but today because of change in our location, I am unable to be at the studio for now, which we apologize for it. But because we live in the world of technology, we live in times of advancement, believe that this can still be done. Wait me, I know wherever we are. And so if you have joined us, we want to thank you for joining us, either on Instagram, on Facebook, on YouTube, and also over the radio station that continue to join us 8 a.m. to 9 a.m. every Saturday morning to have some health awareness and some health discussion. Once we figure out how to have you still call in, then we would have shorter discussion and make it more interactive. That way you can enjoy the show a lot more than anything, because I don't want to be the only one having to talk. Otherwise it becomes monotonous, it becomes boring. Yes, into your cancer, breast cancer, it can affect your brain, it can affect your spine, and if it does, it can cause lots and lots of problems. It can affect your coordination, it can affect your memory. If it's in your brain, it can give you some headaches, and it can also go to your spine. And if it's in your spine, it can give you what you call back pain, especially. So if you're having some back pain that is lingering on for a very long time, you want to make sure that it's properly checked to avoid any late detection of a disease. Atiefoɔ, mekyia mo nyinaa, meda mo ase sɛ mo take time I join it here. The signboard number needs to be, if you didn't get it, it's 07447432 We have just about 3 minutes to 9 a.m. Oh, question bi na pese obisa. Ofrea mbe answer ama. And don't forget to tell a friend, to tell a sister, to tell a brother to join us. Yenya call baako nti me fa na matie ne question no. Me who say call no assign akate into be jana ha epa mucho momfa nche na de yentumi ama man de manfre and bisa more questions no to make it more interactive. Into we will probably end it and then we'll continue definitely by next week. We will take it again. We'll come with a different topic. We'll have more awareness and more discussion, and we'll find a way to have you be able to call in. But thank you very much.
Hey, after 26 December, we'll be here. Hey, Mr. Chrome, how about yet the row?
We have a Chrome over there. 26 December, boxing
enjoy a boxing day. London, how about yet the row? Davidson Band. What's 26 December? By a boxing day extravaganza.
Love goes wild, always. I can see now. If you're feeling it, come and join and sing the song.
And you'll be hot. Now, some will be hot. Oasis Academy, Shelly Park, Shelly Road, Brighton, CR9, 7 a.m. United Kingdom, Major UK, or your cool 30 pounds. Demo programming, it is being hosted by DJ Phone, Only Kweku on Flimbo, DJ on Deck, hey, DJ TQ, supported by the Ghana Society UK, Rainbow Radio, Slicky Promotion, Cosmetic Cocktails, Jacoon's Securities Limited, A-Class Official, Hot Digital Radio, Only B Sherry African Man, Wabashasi, 7 p.m., Legacy 1 a.m., Alex Jewelry, Kapma, when I bet on the Kofi Akanda, a special 20th anniversary edition, it's Afria, and when you take it to the beat, our event rights, and also friend, 077 288 76 027.
Download on Android app.